The prostate gland is found in men and is located between the bladder and the rectum, and mainly is producing enzymes that are important in the composition of the sperm. The prostate is a male gland that is found between the bladder and the rectum and wraps around the male urethra. Its main function is to produce enzymes that are found in the male sperm. With age, the size of the prostate gland increases, leading to urinary symptoms in most men with advanced age. The changes in the prostate cancer cells are different between those found in the inner core of the gland that affect the urine stream and those that are more dangerous around the outer cells of the gland that can be actually felt through the rectum. And that's why for a long time the rectal digital exam was important in identifying men who were developing prostate cancer, since most of these cancers are developing on the outer cells of the gland. When your doctor performs a rectal digital exam, he will feel a hard nodule, which will then prompt him to do more tests, such as a PSA serum test and biopsies that will lead to the diagnosis. Now, over the past 15 years, with the introduction of the so-called PSA test in the blood, more and more cancers have been diagnosed before they can be felt on a rectal exam, and therefore this has become less important of a diagnosis modality in the United States. But still today, in terms to establish a diagnosis and stage the patient, meaning trying to establish how far advanced the tumor has gone, it is important to perform a rectal exam on every patient with suspected prostate cancer.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.